Hi, my name is Sasha Thomason, and I have the pleasure of serving as the Animal Facilities Inspection Program Director for the Kansas Department of Agriculture. I appreciate you taking the time today for this webinar. For the next 60 minutes, we will be focusing on diseases of public health importance in pet animal facilities. This is important to KDA license holders because these diseases can all be passed to humans by the animals in these facilities, whether those humans are the animal caretakers in these facilities or the new pet owner, etc. Before the session begins, though, there are a couple of housekeeping items. During the presentation portion of this session, all participant microphones will be muted by the meeting host. So if you have a question during the presentation, please submit it using the chat button at the bottom of your screen. KDA staff will be monitoring the chat for questions, and we'll ask all those at the conclusion of the presentation. And this session is being recorded and will be posted online next week for viewing, if for those of you that want to see it again or want to tell people to view. And now I'd like to introduce Dr. Erin Petro. She is a state public health veterinarian at the Kansas Department of Health and Environment. In this role, she oversees rabies and zoonotic public health surveillance within Kansas, including consulting with and advising program staff, healthcare professionals, veterinarians, livestock and companion animal owners, and the public on various aspects of rabies, vector-borne, and zoonotic disease transmission and control strategies. Prior to joining KDHE, Dr. Petro was in a mixed animal practice in rural southeast Minnesota. Dr. Petro, I'll now turn it over to you to share your presentation and start.
All right. Well, thank you, Dr. Thomason, and good afternoon, everyone. I'm really happy to be back with you all today and talking once again about zoonotic diseases in dogs and cats and cover some of those pathogens that we didn't get to previously. All right, so here is our outline for today. We'll describe how zoonotic diseases are spread from animals to people, and then I'll get specific on some zoonotic diseases of concern in small animals, and then leave you with some infection control practices and resources to prevent those zoonotic diseases. So as a quick recap, I want to start with defining what zoonotic diseases are. Zoonotic diseases are infectious agents that can be spread between people and animals. And I always like to emphasize that bidirectional flow. We think about it a lot in terms of animals infecting people, but we can also see it in the reverse direction. When we think about routes of transmission, there are three main routes that we're concerned about. The first one is contact transmission, which can be both direct, like something like a bite or a scratch, or indirect through something like a contaminated environment or a fomite. Vector-borne transmission is important when it comes to a lot of these pathogens, and we're primarily concerned about fleas and ticks, and then respiratory transmission when we have inhalation of these pathogens. All right, so here on the slide, I've listed our common zoonotic diseases. And if you attended the previous two webinars, you may remember that we covered the diseases in gray. And today we're going to go in depth on some of the others, which I've highlighted in blue. And I have psittacosis on here, but I'm not going to have time for it. So we're not going to get into that one, but we'll have time for the others. So we'll go ahead and get started. The first disease I want to talk about is cryptosporidiosis, which is a diarrheal illness caused by several species of the parasite Cryptosporidium. Now, many species of Cryptosporidium are host adapted to specific animal species. So, for instance, you can see that Cryptosporidium bovis is host adapted to cattle. And when other animal species are exposed to that, say a dog or a cat, they generally are not going to experience illness. Same thing with a human. If they're exposed to a strain that is host adapted for that specific animal species, like Cryptosporidium canis, they typically are not going to become infected unless they are immunocompromised. So if for most of these the zoonotic potential is low, then why even talk about it today? Well, two reasons. First, I think it's important to know that there are common pathogens amongst people and animals, and that just because we can both be infected doesn't mean that zoonotic disease transmission is occurring. And in this case, they both share the same disease name. In humans, we call it crypto, and animals, we call it crypto. And sometimes our animals get blamed for infecting us when they might not be the source. Second, there is one species of Cryptosporidium that is highly zoonotic and infects a variety of animal species, and that's Cryptosporidium parvum. And just a note, because it sometimes gets confused, this is not the pathogen that causes parvo in dogs. Now, interestingly, this species has not been shown to cause disease in dogs and cats in the US, but it has caused sporadic disease in dogs and cats in other countries, and it can also infect ferrets. So let's take a closer look at cryptosporidiosis in animals. When it comes to crypto, dairy calves are really our poster child for animal infection, which is quite prevalent at about 70% of 1 to 3 week old dairy calves having evidence of infection when we look at a fecal sample. Diarrhea is going to be the most common clinical sign and is often that yellow or pale colors you can see there in the picture. It tends to be quite watery and have mucus in it, and typically this is going to be a mild self-limiting infection, but it can be severe, especially if there is concurrent viral infection with something like a rotavirus or a coronavirus. Now, in contrast to this, often dogs and cats that are shedding eggs of the Cryptosporidium parasite do not have clinical signs. The exception is young and immunocompromised animals who could experience intermittent diarrhea, anorexia, and wasting with that prolonged infection. However, again, clinical illness is rarely seen in our adult animals. Transmission of this pathogen is fecal oral, either through direct contact with infected animals or indirect through fomites and through fecal contamination of food and water. Diagnosis is based largely on clinical signs in calves, plus or minus laboratory evidence. In dogs and cats, we're relying much more on diagnostic tests because infection is so uncommon in them. Diagnosis is best achieved through a reference laboratory because the small size of the parasite really requires skill and practice for an accurate identification. We do have other fecal tests like PCR, antigen tests, and fluorescent antibody tests that are also commercially available. And while there are no currently licensed therapeutics available in the US for Cryptosporidium parvum infection in food animals, there are some treatments there listed for cats and dogs. And really, this comes down to good supportive care and good hygiene to prevent infection in other animals. So here I have the transmission cycle for Cryptosporidium in humans, who again are primarily infected with the human strain of Cryptosporidium, and they are often infected through consumption of contaminated recreational water, such as swimming or contaminated water and ice, or eating contaminated food. They can also be infected through person-to-person transmission by caring for a person and not who is infected with Cryptosporidium and not having good hand hygiene. People can also be infected via direct contact with infected animal feces during the care of infected animals, but we're really thinking about calves, goat kids, and lambs when it comes to that. Now, what's important to remember about Cryptosporidium is that the eggs or oocysts are infectious when they are pooped out of the animal or person. So that really enables that direct and immediate fecal oral transmission. There's also a process of autoinfection, but I haven't shown that on the slide. This occurs entirely in the body at the intestinal lumen layer. So there have been over 49 Cryptosporidium species identified to date, and about 95% of human cases are due to Cryptosporidium hominis, which is the human host adapted Cryptosporidium, and Cryptosporidium parvum. Like calves, the most prominent symptom in humans is watery diarrhea that is prolonged and frequent. Some people can also experience nausea, vomiting, stomach cramps, and dehydration. For most immunocompetent people, this is a self-limiting infection. However, in those with a weakened immune system or who are taking medications that suppress their immune system, we can see more severe illness that affects other parts of the body like the biliary tract, the pancreas, or even the respiratory tract. And these people can also develop chronic illness and life-threatening disease. For treatment, it's going to consist primarily of supportive care. So, next, I want to talk about some of the risk factors that we see associated with crypto in humans. And the primary one, well, a couple of ones, the first one is going to be international travel. And that is primarily because of contaminated food and water sources. Another big risk factor is our recreational water. So I mentioned that those oocysts are infective immediately when they are shed. So if we have someone who has crypto or has recently recovered from diarrheal illness because of crypto, and they visit something like a pool, we can really see large outbreaks because crypto is also resistant to chlorination. So underchlorinated pools or unchlorinated pools, and a person who's actively shedding with people who are getting water in their mouths during the course of swimming can really be a great source of infection. Another risk factor are caregivers to children 3 to 11 years old. Now, these children are probably independent in the bathroom, but they might need help with certain things and they don't have great hand hygiene. There's also some popular activities. Here on the slide, I have a picture of a water table at a daycare. That is a great medium for spreading crypto. And then finally, contact with calves is also a recognized risk factor for crypto in humans. So, when it comes to crypto, what we want to remember is that prevention is through good hygiene, primarily hand hygiene. So, next I'll talk about toxoplasmosis, or toxo as it's commonly referred to. Toxoplasmosis is a zoonotic infection caused by the parasite Toxoplasma gondii. Toxoplasmosis is a really interesting parasite in that it can infect an impressively wide variety of species, including mammals, birds, and marine mammals, and humans. Really, any vertebrate that is warm blooded can become infected with toxoplasmosis. It's also unique in that it can be transmitted by various routes, as we'll discuss on the following slides. And finally, the clinical presentation in both humans and animals varies depending on the immune status of the individual. And here on the slide, I have a picture of the parasite. This is the tachyzoite stage, which is that rapidly dividing stage that disseminates to different tissues in the body. So here we have the life cycle of toxoplasmosis. It's a complex parasite, so I'm going to walk through the transmission step by step. So first, we'll start with the cat, who, along with other members of the Felidae family, is the only known definitive host for toxoplasmosis. And what that means is that cats are the only animals that shed eggs in their feces. After that, it takes anywhere from 1 to 5 days for those eggs, or oocysts, to sporulate and become infective. After this, the intermediate host, usually rodents or birds, ingests the sporulated egg through water or plant material that is contaminated with the eggs, and then they become infected. In the intermediate host, the parasite forms a tissue cyst. And then the life cycle is completed when another cat eats the infected bird, mouse, or other intermediate host. What is not shown on this transmission cycle is that infection can also be transmitted transplacentally or transmammary from mother to offspring, although this rarely occurs in our pet animals. Okay, so that's the cat side of the life cycle, pretty straightforward. Now let's look at the human side of the life cycle. We start again with the cat, shedding oocysts in their feces, and those oocysts taking about 1 to 5 days to sporulate before they become infective. Then we've got several potential paths of infection from there. One route is that an intermediate host, like a deer, eats the infective eggs and forms a tissue cyst, just like the mouse and the bird did. A human eats the undercooked deer meat and is infected. Another route of transmission is through a contaminated environment, and this can occur through the ingestion of fresh fruits and vegetables, contaminated water, or through activities that bring you in contact with a contaminated environment, such as gardening. The person ingests it and they become infective. Another route of transmission that often results in severe fetal outcomes is transplacental transmission from mother to child. And we'll talk more about that in a bit. And then finally, it is possible to acquire toxoplasmosis through blood transfusion or organ transplant, though this is not common. Once in humans, the parasite forms tissue cysts, and commonly those occur in skeletal muscle, heart muscle, the brain, and the eyes. All right, so now let's take a look at toxoplasmosis in animals. I have on here again that felids are the only definitive host. And I just want to really explain this because a lot of times when we think about toxoplasmosis, we think about cats in litter boxes. But we really need to understand what's happening when cats are infected with toxoplasmosis. So when cats are first infected, they will shed eggs in their feces for about 1 to 3 weeks after that initial infection. And importantly, this is the one and only time typically in a cat's life, that it will shed infective oocysts in its feces. Those eggs or oocysts are not immediately infective. They take 1 to 5 days to sporulate before they actually become infective. So just keep that in mind when we talk about prevention measures and things like that. And although felids are the definitive host, they typically don't experience clinical symptoms. And that's because the tachyzoid stage, which is that rapidly dividing stage that's responsible for tissue damage, is controlled by the immune response of the adult immunocompetent animals. So, therefore, the clinical signs really depend on the affected tissue, the number of tachyzoids released, and the ability of the host immune system to limit replication and transmission. So, in adults, toxoplasmosis is typically a subclinical illness or they're asymptomatic. However, immunocompromised adult animals, such as cats infected with feline immunodeficiency virus, are extremely susceptible to acute generalized toxoplasmosis, and that is mainly expressed as a neurologic or respiratory disorder. In susceptible species, as well as in young immunocompromised animals, particularly puppies, kittens, and piglets, these tachyzoids are transmitted systemically and they can cause an array of tissue damage, leading to fever, diarrhea, cough, difficulty breathing, that kind of yellowing of the skin, seizures, and even death. And then finally, Toxoplasma gondii is also an important cause of abortion and stillbirth in sheep, goats, deer, and sometimes pigs. And that has to do with those tachyzoids. So, after infection of a pregnant ewe, for example, those tachyzoids are transmitted via the bloodstream to the placenta, and they can there cause necrosis, which interferes with blood flow, oxygenation, and the delivery of nutrients to the fetus. Tachyzoids can also be transmitted directly from the fetus transplacentally, leading to necrosis in multiple organs. So that congenital transmission really has severe consequences for the fetus. And whether the transplacental transmission causes the death of the fetus partly depends on the time of gestation when infection occurs. So if the dam is infected early during gestation, when that immune system is still immature, then transmission commonly results in fetal death and resorption. When infection occurs at mid gestation, abortion often occurs or delivery of a stillborn lamb are going to be the more common outcomes. While dams infected late in gestation could deliver a stillborn lamb, a congenitally infected weak lamb, or even a clinically normal appearing offspring. So, clinical signs of toxoplasmosis really are nonspecific and are not sufficiently characteristic for a definitive diagnosis. So, if we're looking at an antemortem diagnosis, we can accomplish that by various serology tests, samples of the CSF, or even samples of the aqueous humor. And then for postmortem examination, we can look for those tachyzoids or those slower dividing bradyzoids in tissue samples. And since Toxoplasma is similar to other protozoal parasites that are involved in abortions and infection with neurologic tissues, we have to differentiate those by PCR samples on those tissues. For treatment other than humans, treatment of toxoplasmosis is seldom warranted. There are a number of different drug combinations of anticoccidials, antibiotics, and antiprotozoals that can be used in the acute stage of infection when you have those rapidly dividing tachyzoites. But what's important to remember is that treatment is not going to eradicate the infection, and no drugs are really effective at that bradyzoite or tissue cyst stage. So once an animal is infected, it's not something that we're typically going to be able to eradicate through any type of drug treatment. So what we really want to focus on is prevention. And since cats are the definitive host and they're the ones that are putting those eggs out into the environment, the first step in control is to prevent infection in cats. So we can do that by feeding dry, canned, or cooked cat food only. We don't want to feed raw food to cats because those tissue cysts can be present in raw food. So even like raw chicken diets, raw turkey diets can have tissue cysts and cats can become infected that way. Keeping cats indoors is a good prevention measure because I see a question there. What about milk? So we can, raw goat's milk and sheep milk are going to be the high risk things as far as milk goes. Pasteurized milk would be safe to feed to cats. So keeping cats indoors so that they can't prey on rodents, birds, and those other intermediate hosts. Cleaning the litter box daily is going to be really important when you're introducing new cats into the household with your older established cats or into a new population of cats. And that goes back to those oocysts not being infective for 1 to 5 days after the cats defecate. So if you're cleaning that daily, you're never having those infective oocytes there for another cat who's never been infected to be exposed to it. So that's how it helps prevent infection in cats as well. Next, because it's so impactful from a reproductive standpoint, I want to quickly discuss prevention in livestock species, particularly in small ruminants. So again, since cats are the definitive host, we want to prevent access of cats to livestock areas so that we're not getting as much contamination in the area with those eggs. And then we also want to prevent access of rodents to livestock areas. And that's especially important for our omnivorous livestock species like pigs, who will happily eat a rodent that gets into their area. The next prevention measure is focused on, again, trying to keep rodents and cats out of the livestock area. So keeping feed in an area where it's going to be protected from getting contaminated with cat feces, where rodents aren't going to get into it or other pests. And then providing only clean, fresh water sources for our livestock species, since we can see water contamination too. All right, so now let's switch gears and talk about toxoplasmosis in humans. The CDC estimates that approximately 11% of the US population 6 years of age and older, or about 40 million people, have been infected with Toxoplasma gondii. So that's not insignificant and is also a really impactful disease when it comes to foodborne illness. However, since toxoplasmosis is not a nationally notifiable condition, meaning that it's not reportable to public health, it's difficult to estimate the number of illnesses that are caused due to foodborne transmission. However, from other data sources, we find that despite not being in the top 5 pathogens for causing illness, it is the number 4 cause of hospitalizations due to foodborne illness, and it's the number 3 cause of foodborne illness deaths in the United States. And just like with animals, when it comes to humans, those that are immunocompromised are at a higher risk for severe illness. Now, here on the right-hand side of the slide, in no particular order, I've got the various sources of exposure in humans. So humans can be exposed through a contaminated environment. This is going to be something like a sandbox, gardening, or contaminated soil. We just mentioned that foodborne transmission is an important route that can be through fresh fruits and vegetables, undercooked meat, and unpasteurized goat or sheep milk. It's really goat and sheep milk that is the risk there for toxoplasmosis. It can be fecal oral directly there from infected cats not having good hand hygiene after cleaning a litter box. We see congenital transmission when the mother is infected during pregnancy, and then we also see infection from contaminated water sources. So now let's move on to some of the symptoms of toxoplasmosis in humans, which really come in 5 broad categories. So first, just like in animals, we can have asymptomatic infections in humans. I would say probably the most common is that mild flu-like illness. So people might think that they just have a flu or a stomach bug, fever, muscle aches, kind of muscle pains, typically lasting about a week and being a self-limiting infection. With congenital infection, we can have severe outcomes like miscarriage and stillbirth. We can have vision loss when toxoplasmosis infects the eye, or mental disability and seizures when it gets into the nervous system of those unborn babies. We can see ocular infection. So those tachyzoites that I mentioned disperse in the blood and go to different tissues. And one of them that they like to go to is the retina. So when we have an ocular infection, we see reduced or blurred vision. You can have eye redness and tearing and pain with bright light. And then finally, immunocompromised individuals can really have severe infection, fever, headache, and then when we start seeing symptoms of nervous system infection, we'll see altered mental status, seizures, incoordination, and sometimes even fatal infections. So, when I'm thinking about toxoplasmosis, I really wanted to emphasize those high risk groups, and that's really going to be pregnant persons and their infants and immunocompromised persons, because that's really where we see the severe outcomes from infection. And then when I thought about high risk exposures, I wanted to look and see what kind of evidence do we have? Because as I mentioned, cats get blamed a lot, and it's kind of a pet peeve of mine because there's so many different ways that people can be infected with toxo. So what the literature shows us when they've done case control studies to look at these exposure sources. I've listed them on here, and you can see that they're really variable, and it's dependent on geographic area. So, where in the world you live, what the cultural customs are in areas where it's more common to eat raw meat, we see higher rates of infection. What the local sanitation is like. So, in some areas, drinking well water or unboiled water is associated with a higher risk of infection, and then kind of what the care is like of cats in that community. If we have high rates of cats that are stray or uncared for in the community, exposure to soil and contact with cats might be higher risk. The two studies that I found from the US found that there was a higher risk among people with a lower educational level and crowding, and it didn't really go into detail on those exposures. So now let's talk about prevention. And I've broken this section down into the main ways that people are exposed. So the first is preventing infection at its source. And that is where it comes back to really trying to prevent cats from being exposed to toxoplasma in the first place. And one way that we can do that is keeping cats indoors so that they cannot prey on those infected intermediate hosts. Another way is to feed only commercially prepared cooked diets to animals. Again, feeding that raw based diet is a risk factor for toxoplasmosis, and then emptying the litter box daily and washing our hands afterwards. When it comes to environmental prevention measures, there are a few steps that we can take. So, first, wearing gloves when gardening or when touching any soil or sand that could be contaminated with cat feces, and then washing your hands with soap and water after gardening or contact with soil or sand. Second, always cover outdoor sandboxes and make sure that the cover is nice and tight so that cats can't gain access to it and use it as a giant litter box. And then finally, looking at the foodborne illness aspect of prevention, there are several steps that people can take to reduce their risk of toxoplasmosis infection through food and water. The first is going to be washing or peeling fresh fruits and vegetables thoroughly before eating. They can be contaminated with water that is contaminated with toxo, so they have those eggs on them and they remain infective when you purchase them. You can cook game meat thoroughly before consuming. We have started to see more cases and small outbreaks associated with eating undercooked venison. So that's really an area of prevention that we've tried to emphasize recently. And then cooking all meats to a recommended internal temperature is good practice for the prevention of toxoplasmosis and other foodborne illnesses. Freezing meat for several days before cooking it is helpful. It doesn't always kill the toxoplasma parasite, but it certainly makes it a little more susceptible to cooking and in some cases will kill it. Not eating raw or undercooked oysters, mussels, or clams is one that people might think about or not think about, but these are filter feeders. So if they are living in infected waters, they can become infected, and then people commonly eat them raw. And so that's a source of infection. Not consuming unpasteurized sheep or goat's milk because we can commonly see those tachyzoites passed through the milk, and then not drinking untreated surface water. All right. So I feel like that was a lot with toxoplasmosis. So I figured we could just take a little breath before we go into our next disease. All right. So moving on to our next disease, I want to start this one off with a case report that was just published in Morbidity and Mortality Weekly Report in July of this year. On January 19th, 2024, a 2-year-old cat began receiving veterinary care in Central Oregon for a neck abscess and vomiting. The cat was initially treated with an oral antibiotic. On January 24th, the abscess was excised and drained by the veterinarian. The next day, the cat's owner, a man aged 73 years old, cut his right finger with a kitchen knife and sought treatment at an urgent care facility in Central Oregon. The wound was irrigated and sutured, and the man returned home. That same day, he reported having close contact with his cat, which was still under veterinary care. On January 26th, the man noticed a new tender raised ulcer on his right wrist. 4 days later, he sought care at an emergency department. His signs included cellulitis and lymphadenitis extending up his right axilla, originating from that ulcerated wrist lesion. He was admitted to the hospital and initially treated with empiric IV ceftriaxone and metronidazole for presumed bacterial lymphangitis. So they did diagnostics and a pathogen was detected. So a diagnosis was made by blood culture, which was evaluated at the hospital microbiology lab and was confirmed by PCR at the Washington State Public Health Laboratory on February 6th. Based on culture results, antibiotic therapy was changed to IV gentamicin and IV levofloxacin, which resulted in improvement in the patient's cellulitis, lymphangitis, and lymphadenitis. The following day, he was discharged and prescribed a 9-day course of oral antibiotics. At his follow up appointment on February 15th, he appeared to have made a full recovery with only mild residual fatigue. Unfortunately, the owner was not able to give the cat its antibiotics after surgery, and the cat passed away on January 31st. After the diagnosis was made on the owner, those results were reported to the state public health veterinarian, who, suspecting zoonotic transmission, contacted the CDC to request confirmatory testing of the cat. CDC's Diagnostic and Reference Laboratory in Fort Collins, Colorado, requested tissue sections from the cat's liver and spleen and subsequently confirmed the presence of the same bacterium via PCR and tissue culture. So, does anybody have any guesses what this pathogen might be? You can put it in the chat if you want. I might be able to see that. No guesses? Okay. All right. Well, we'll go on. It was plague. So, plague is caused by the bacterium Yersinia pestis, and it can infect both humans and other mammals. Plague occurs naturally in areas of the western U.S. where it circulates among wild rodents and other animals. And humans usually become infected by the bites of an infected rodent flea or by handling an infected animal. However, infection can also occur through contact with sick pets, especially cats. Plague is also infamous for killing millions of people in Europe during the Middle Ages, and that's where we get our plague doctor graphic from. You may have also seen plague in the news recently, too. On July 8th, Coconino County in Arizona issued an alert after they had a large prairie dog die off in the Winona area northeast of Flagstaff. The alert warned that sudden die offs in prairie dogs can be an indicator of plague. And then 6 days later, on July 14th, a pneumonic plague death was reported from that same county, although it was determined that this death had no connection to that prairie dog die off. There have also been reports of plague recently in a person from South Lake Tahoe, California, and the New Mexico Department of Health announced a case in a resident just about 2 weeks ago. However, despite the recent headlines, plague is a rare disease, with the U.S. reporting an average of 7 cases per year. This map shows reported cases of plague in the US, which again shows that cases typically occur in the rural West, in that kind of Four Corners region there. The handful of cases that are reported in the US in the eastern part of the US are among people who traveled from the West or who were exposed through laboratory exposure. So, what's the situation look like here? And do we need to be concerned about plague in Kansas? Well, we have records from the Centers for Disease Control and Prevention that document plague in Kansas between 1945 and 1950. But since then, there was no documentation of plague in the state, including no human cases. However, following a die off of a black tailed prairie dog colony on the Cimarron National Grassland in June 1997, the U.S. Geological Survey Division of Biology at K State tested fleas from those burrows, and they were positive for Yersinia pestis. So we may still have plague bacteria circulating naturally in the environment there in the southwest corner of the state, which is good to be aware of if you have an animal with compatible symptoms who traveled to that area of the state and had potential exposure to fleas or animal carcasses. And then I just wanted to show on the map where the Cimarron grasslands are there in the extreme southwest corner of the state. All right, so let's quickly look at plague ecology and how transmission occurs in the US. Plague occurs naturally in those semi-arid grasslands and scrub woodlands of southwestern states of Arizona, Colorado, New Mexico, and Utah, commonly referred to as that Four Corners region. That bacteria cycles among wild rodents, including rock squirrels, ground squirrels, prairie dogs, and wood rats. Occasionally, infections among rodents increase drastically, causing an outbreak or epizootic, as shown there on the right-hand side of the slide. And this results in rodent die offs, as we saw in the Townsend Winona area in Arizona. which causes those hungry fleas to seek other sources of a blood meal. And then this is when we get spillover into domestic animals and humans. So transmission can be vector-borne when infectant rodent fleas bite humans and animals, or it can occur through contact transmission with sick animals, like a cat eating an infected rodent. Cats usually become very ill from plague and can directly infect humans when they develop pneumonic plague and cough those infectious droplets into the air. Dogs are less likely to be ill, but they can still bring plague infected fleas into the home in these areas. So, the most common route of transmission is going to be through, in companion animals, is going to be through ingestion of those infected rodent or rabbit carcasses. Another common route of infection, though, is vector borne from those infected fleas. So, when we talk about symptoms, we'll start with cats. Cats present with three clinical manifestations of plague. The first one is bubonic plague, which is the most commonly observed form in cats. They usually present with a high fever, lethargy, anorexia, and regional lymphadenopathy, or those buboes. They can have abscessed lymph nodes, which are frequently observed in the head and neck region and can appear similar to abscesses from bite wounds or are other common causes. They can also have oral lesions, skin abscesses, discharge from the eye, diarrhea, vomiting, and cellulitis. So here we have a picture of a cat with bubonic plague, and you can see those two areas of skin crusting there on the front leg and the back leg. Cats with septicemic plague present with a high fever, lethargy, and anorexia, which quickly progresses to overt signs of sepsis. So we see vomiting, that increased heart rate and cold limbs, pale gums, and eventually multi organ failure and acute respiratory distress. These patients do not necessarily have enlarged lymph nodes. The third form is pneumonic plague, which may develop secondary to the other forms and is characterized by fever, difficulty breathing, oral or nasal discharge, and coughing or sneezing. And this form is of particular public health significance because it can be transmitted to cat owners and veterinary clinic staff via those infectious respiratory droplets. Dogs, again, are less likely than cats to develop clinical illness from infection with Yersinia pestis. However, it has been documented on several occasions. Most commonly, we see sort of a transient fever and anorexia that is mild and lasts less than 3 days, accompanied rarely by lymphadenopathy. Severe disease, including respiratory involvement, is possible in dogs, but again is rare. So, when it comes to treatment, early antimicrobial therapy is imperative to improve the chances of survival. The patient should be hospitalized and administered flea treatment and cared for in isolation by personnel wearing appropriate personal protective equipment so that we don't have that zoonotic transmission. So, this would include gloves, masks, and eye protection. Standard disinfection procedures should be used when handling the animal or its infectious materials. And we really prefer parenteral treatment with antibiotics for those first 48 to 72 hours so that you can prevent human exposure during administration of oral antibiotics. However, you can switch to oral therapy after that first 48 to 72 hours, and treatment is recommended to continue for 10 to 21 days. So, how do we prevent plague in our companion animals? We again want to think about the source of exposure, which in this case is wild rodents and rabbits. So, first, animals in plague endemic areas should not be allowed to roam and hunt and should not have access to rodent and rabbit carcasses. We also want to protect our pets from vector borne transmission by maintaining pets on a veterinarian recommended flea preventive. And because this disease can be so rapidly fatal, sick pets should be examined promptly by a veterinarian so that treatment can be initiated quickly. All right, so now switching over to humans. They're kind of like cats, actually. Symptoms depend on the route of exposure, and in humans, we see three forms of plague again, bubonic, septicemic, and pneumonic plague. So I'll just go through the three of those quickly. Bubonic plague is going to be the most common type of plague in the US, and it usually results from the bite of an infected flea. The bacteria then multiply in a lymph node near the bite site where they enter the body. Patients with bubonic plague develop systemic illness of fever, headache, chills, and weakness, and then one or more swollen, painful lymph nodes called buboes. So you can see that there on the patient's groin area in the picture. The next form is septicemic plague, and that usually results from bites or infected fleas or from handling an infected carcass. Patients develop fever, chills, extreme weakness, abdominal pain, and then as they start developing those signs of sepsis, shock, and bleeding into other organs. And as shown here, the skin and other tissues can turn black and die, especially that peripheral skin, so fingers, toes, and the nose. Septicemic plague can occur as the first symptom of plague, or it can also develop secondary from untreated bubonic plague. And then the third form in humans is pneumonic plague, which develops when bacteria spread to the lungs of a patient with untreated bubonic or septicemic plague, or when a person inhales infectious droplets coughed out by another person or animal with pneumonic plague. So these people will have fever, headache, weakness, and that rapidly developing pneumonia that you can see there on the chest x-ray. Pneumonic plague is the most serious form of the disease in humans and is the only form of plague that can be spread from person to person. So here we have some prevention tips from the CDC, which really apply to where areas of plague are endemic. The first is going to be to reduce rodent habitats around the home, workplace, and recreational areas by removing brush, piles of junk, firewood, things like that, where rodents can congregate and have a habitat. Next, we want to make sure that we're wearing gloves anytime that we're handling dead animals so that you can prevent contact between your skin and the plague bacteria. If you are going to be in an area enjoying the outdoors, camping, hiking, or working outdoors, and you might be exposed to fleas, you want to make sure that you wear repellent and use products that contain DEET or permethrin because they are very good at repelling fleas. And then finally, keeping fleas off of your pets by applying veterinary flea control products. It's also very important to use products that are labeled only for that animal because some products like permethrin are highly toxic to cats. So you don't want to be using those products off label. And then if you have a sick pet, it should not share sleeping areas with other family members. All right, our final disease is going to make its appearance in outbreak form. So it started in Wisconsin in June of 2003 when monkeypox was diagnosed for the first time in the Western Hemisphere. By the time all cases were identified and the outbreak was contained, it had spread to 6 states, caused 93 animal illnesses and 71 human illnesses. The virus was introduced through the transnational movement of animals, mixing various susceptible species once into the US, and then the distribution of animals through various venues. So let's explore what happened. On April 9th, 2003, a shipment of 800 small mammals arrived at a wildlife importer in Texas from Ghana, Africa. The shipment contained 800 small mammals, of which at least 9 species could have been the actual source of introduction of monkeypox. From there, the distributor in Texas sold Gambian giant rats to an animal distributor in Iowa on April 15th. That animal vendor sold the Gambian rats to another animal vendor in Illinois, who housed the Gambian giant rats in close proximity to prairie dogs. They sold those prairie dogs to another animal vendor in Wisconsin. And that's actually where the story began, when the index patient presented with cellulitis and fever after being bitten by a prairie dog on May 13th. The prairie dog had been purchased 2 days earlier at a swap meet. Initially, tularemia and plague were suspected, as these are common zoonotic pathogens associated with febrile illness after a rodent bite, like we just learned. However, no diagnosis was reached in that case patient. 2 weeks later, the Wisconsin Department of Public Health received a report from Marshfield Laboratory that the mother of the first patient had become ill about 2 weeks after her daughter. The mother developed a skin lesion, and pox virus was seen on electron microscopy. Meanwhile, the prairie dog had become ill on the same day that it bit the child and was noted to have ocular discharge and lymphadenopathy and papular skin lesions. It subsequently died on May 20th. Lymph node samples were also sent to Marshfield Laboratories for bacterial culture. Again, plague and tularemia were at the top of the list. However, neither grew from the culture. So It kind of was a stroke of luck in this situation because Marshfield Laboratory processes both human and animal samples. So, after the pox virus was seen on the mother's skin lesion sample, the lab put the pieces together. And on June 4th, orthopox virus was seen by electron microscopy of cell culture from both the prairie dog and the mother. And here on the slide is an actual picture of the tissue from that very first case of mpox. So, after monkeypox was confirmed, the epidemiology team started their trace forward investigation, in which all animals that left the animal vendor in Wisconsin were traced to identify additional cases and contacts. So, they found that this vendor brought the prairie dogs to swap meets and sold them to buyers in Illinois on April 20th, May 3rd, and May 18th. Indiana on April 27th and May 18th, and Ohio on April 19th. In addition, the animal vendor in Wisconsin sold infected prairie dogs at a swap meet in Wisconsin on May 18th. If you've been to a swap meet, you can imagine how difficult it would be to trace where the animals were bought and sold, and in several instances, invoices and other records were incomplete, so making that impossible to identify all individuals who may have purchased infected prairie dogs. So here's a picture of some of the infected prairie dogs, and notice the scabby skin and the dull look they have, especially in these two here. You can really see the lesions there on their body, and just kind of their eyes are a little more squinty and dull looking. So now I want to talk about some of the public health actions that resulted from this outbreak. The majority of human cases reported some contact with an infected prairie dog. And because of that, on June 7th, the governor of Illinois issued an executive order to temporarily prohibit the importation, sale, distribution, and public display of prairie dogs and Gambian rats. A couple of days later, the HHS announced an immediate embargo on the importation of all rodents from Africa. And along with that, the FDA banned the distribution, sale, and transport of prairie dogs and 6 African rodent species. The FDA ban was subsequently rescinded 5 years later. However, the CDC's ban on the importation of all African rodents is still in effect, and this actually applies to rodents that are both dead and alive, and those whose native habitat is Africa, even if that rodent was born elsewhere. And then the following day, the Wisconsin Department of Health issued an emergency order prohibiting the importation, sale, and release of prairie dogs or any mammal known to have had contact with a prairie dog since April 1st. And then you may have caught there on the first slide that Kansas also had a case. And so, because of that, prairie dog ownership is prohibited in Kansas. So, what about our companion animals? To date, there have not been any documented cases of Mpox, which I should have said this in the beginning. After the 2022 global outbreak of monkeypox, the disease name was changed to Mpox. The virus is still monkeypox virus. So there have been no documented cases of Mpox in dogs or cats. There was one case report in 2022 that suggested human to dog transmission of monkeypox virus from 2 infected owners that co-slept with their dog. However, a follow-up investigation of that case did not establish disease in the reported animal. So we do know that dogs and cats can both be infected with other orthopox viruses. So it's really best to take infection prevention precautions if a person has Mpox. So these precautions include having someone else care for your animal until you're completely recovered, if possible. If not, avoiding contact with your animal as much as possible and not having direct contact of skin lesions with the animal. And then cleaning and disinfecting the home thoroughly will also help reduce the risk of spread from humans to pets. So, even though there has never been a case of Mpox in a dog or a cat, I like to include these prevention measures on here and talk about it because of the close interaction that many of us have with our pets on a day to day basis. Petting, kissing, sleeping in the same bed, or allowing our animals on the furniture is pretty normal for most people. And virus transmission routes can change. When I was reading about the 2003 outbreak, I was really struck by a specific quote in one of the articles. So it said, quote, person to person transmission documented in African outbreaks has rarely extended beyond 3 or 4 transmission cycles. Worst case scenario models suggest the disease is not self sustaining in human populations, even in the total absence of immunity provided by smallpox vaccination. End quote. So in 2004, They were basically saying that person-to-person transmission not only didn't occur in the 2003 outbreak, but it would likely never become a significant route of infection. Fast forward almost 20 years to 2022, and we have the largest outbreak hitting global pandemic proportions of person to person transmission of Mpox, which resulted in more than 114,000 human cases worldwide with over 220 deaths. And we continue to see small outbreaks of clade 2 Mpox being transmitted person to person in the US. So I just think it's important to think about, even though there's no proven transmission, we still want to take those preventive measures so that we're not introducing something new that didn't happen before. So now that I've discussed a few specific pathogens, we'll talk quickly about how we can prevent these pathogens, especially as it relates to zoonotic transmission. And I'm not going to go into depth on this section because we covered it last time, but just as a summary, I really can't emphasize enough hand hygiene. Washing hands is probably the single most important measure we can take to prevent zoonotic disease transmission. And we want to think about those at key times. So after touching, feeding, and caring for your animals, anytime that you are cleaning up animal waste, you want to do that promptly and wash your hands afterwards. And then really having a facility infection control plan is useful to keep people accountable and so that they know when they should be implementing those infection control measures. Regular and routine veterinary care is important for the preventive side of things, thinking about flea, tick, and heartworm prevention. And I just throw heartworm on there because it also often includes intestinal parasite control. So we're preventing zoonotic transmission there. And then interacting safely with animals. So we really shouldn't kiss animals on their mouths or let them lick your face. That's a great route of transmission for many of these pathogens. And then supervising young children around animals. Unfortunately, they are more often the victims of bites and things like that. So just keeping those prevention measures in mind. Here are some really great infection control resources that you can take a look at. And that is my last slide. Here's my contact information, and I am happy to take any questions that you may have. And I saw some in the chat, so I'm just gonna um, open that up so I can see. Oh boy, the greatest. Okay, so the question is, what does Dr. Petro judge to be the greatest zoonotic disease threat to public health in Kansas? That is a tough one. I don't know that I have a great answer for that. Um, there are just so many zoonotic diseases out there. I mean, right now we're in the middle of vector season, so I think a lot about just ticks and tick-borne diseases. Tularemia is a really important one that we're starting to see more associated with cat bites. When we think about the prevention aspect, rabies is one that comes top of mind because it is so easily prevented through a safe and effective vaccine. And it's something that's endemic in Kansas, and we see cases every year, human exposures every year. So those are kind of the ones that come top of mind, but there's a lot out there. Why did the CDC rescind their ban? So the CDC did not rescind their ban on African rodents. They're still banned by the CDC for importation, but the FDA rescinded their ban on like the interstate movement, sale, and transport of prairie dogs and rodents. I don't know why. Maybe they didn't see them to be as much of a threat because we only had that one incursion of Mpox at that point in time. That was in 2008 that they rescinded it. And possibly because importations are now banned, we're not having those exotic African rodents coming in. It's more prairie dogs that are born here and rodents that are from other places in here. Not really sure on that. Shane, very funny. Risk management, exactly. That's a really good point. We want to think about that. I definitely don't want people to stop interacting with animals or enjoying their hobbies, but I really think it's important that we think about risk management. And that's why for toxoplasmosis, I really wanted to identify those high risk groups because people are going to do things that they enjoy, like gardening or eating meat on the rare side or things like that. And that's their prerogative, but there are things that we can do safer. So, for instance, eating venison rare is really not a great idea. Maybe choose something like a steak. So, anyways, that's a funny one. All right. Are there any other questions or comments? And I also do not let my kids play in sandboxes. So that's one that I think is just gross. I do not like public sandboxes.
Yeah. Now, thank you, Dr. Petro, for being here and doing part 3 of this series for us. Really, really appreciate it. And we hope, or we thankful for everyone else that joined us. And yeah, we hope you have a good day, and think we'll sign off.
All right. Thank you. Appreciate it.
Thanks. Bye-bye.